Hi there, my name is Dr. Monique Ruberu and I am a naprotechnology trained OBGYN physician. Oftentimes I encounter men and women in my office who are dealing with infertility. This is a really difficult time in their lives. These are people who maybe have tried to conceive for about a year on their own and haven't had success, or they might be people who've already gone through a whole battery of tests and treatments with another physician, and they're coming to me to see what I can offer to help them out. Well, luckily, with naprotechnology, we have so many different options to offer these patients. The most important thing or starting point is for these patients to truly try and understand where their infertility is coming from and what is going on in their bodies. So we oftentimes will ask these patients to begin this journey by looking at Crichton Fertility Care Natural Family Planning charting. When you learn to chart with Crichton Fertility Care Natural Family Planning, what you'll start to notice is that everybody has different bleeding patterns and mucus patterns. The length of cycle might be different. Even month to month, these patterns may change slightly. When we can identify these patterns and see what is abnormal in comparison to what a normal chart would be, then we can start to determine what the cause might be. You see, things like a bleeding pattern which shows very heavy bleeding could indicate the presence of fibroids. If you have bleeding patterns that show tail end brown bleeding at the end of your cycle, it may mean that you have lower levels of progesterone. If you have really long cycles, it could mean that you have polycystic ovarian syndrome or possibly even issues with your thyroid. All of these things are really wonderful tips that we can look at through the charting, which would guide our next steps in investigation. After you've charted for a full 2 cycles, then we would have you come back and we'd look at the charts with you and we determine when to draw labs to look at your estrogen and progesterone profiles. When we do that, we can compare what your estrogen looks like before ovulation and after ovulation, and what your progesterone looks like after ovulation to what normal charts look like. When we compare these charts, we can see what is lacking, and then we can try to supplement back to bring your charts back to normal. Oftentimes that's enough to address some of the infertility issues. We also would really take a close look at the quality of the mucus that's present. We could offer natural treatments to help boost this mucus. When we get a husband to do a semen analysis, we don't hand them pornography and send them off to another room to collect that sample. Instead, we'll offer you an ethical option to be able to come together and use a perforated condom so that you can collect the sample and send it off to the lab or to another reliable send away lab. And that would come back with a wonderful semen analysis, which gives us lots of information. We can then look at the semen analysis and we can offer you supplements to specifically address any abnormalities that we find within that semen analysis. Over time, with charting and continuing to check labs, we can verify that these treatments are actually making a difference. Sometimes surgical intervention is needed, and we have specially trained naprotechnology physicians who have done years of naprotechnology surgery to help you with things like endometriosis or blocked tubes or other issues that could be causing problems with fertility. At the end of the day, your goal and our goal is to help you be the healthiest that you possibly can be. We can't ever guarantee you that you are going to conceive through your uterus, but we definitely can guarantee you that through this work, you'll have a far better understanding of what it is that's causing you to have difficulties with your fertility. I think one of the worst things that a person can ever tell a patient who's suffering with infertility or decreased fertility is that their infertility has no reason or no cause. They would maybe label you as an unexplained infertility patient. And that's really hurtful for many patients because everything about me is completely normal, but I just can't conceive. It's just not fair. So we want to help you find the answers so that you can decide what you want to do. Do you want to continue trying to conceive in this way? Do you want to move on to other ways that you can expand your family, such as foster or adoption? or taking on the responsibility of mentoring multiple children in your community and being a really amazing figure of strength and support for those kids, how are you going to grow your family? Let us talk to you, let us understand where you're coming from, and let us support you in this journey. If you're interested in having our help at Natural Women's Health, just check out naturalwomenshealth.com. We'd be happy to talk to you through our little chat on our website, and we're happy to answer any questions that you have, and more than anything, we'd be happy to meet you in the office and give you really outstanding care. Take care. God bless you. Thanks so much.